in yes or no. Yeah, thanks, Kavya. Okay, thank you, everybody. Let me just start. Yeah. Okay, so thank you everyone for joining this free masterclass on improving fertility naturally by Velcure and Dr. Rishivardhani. Without wasting your time, let's move ahead with today's introduction. Those who are new to Velcure, let me introduce Velcure first. So, Velcure is an digital natural healing platform where we regularly host live workshops, live group coaching programs, many free masterclasses, and we also offer e-learning courses. You can visit our website, that is www.wellcare.com, for our latest updates. We also offer many free healthy recipes which you can find in our mobile application Wellcare and on our website. And we also offer personalized health coaching program which is completely personalized with our doctor and nutritionist team. So if you want to take your health concern with us, you can book for the personalized coaching program with us. When you visit our website, you also see many healing blogs and journeys. And if you have any questions regarding your health problems, so you can put your questions in the chat section and our expert will answer you. Moving ahead, so before we begin with today's session, there are some ground rules that we all have to follow. That please stay on mute when you are not speaking. Please keep your phones on silent mode. If you have any questions, then the chat section is open. You can put your question there, and it would be great if you stay on today's topic for questions only, and you can keep your webcam off if you are not comfortable. The session will be conducted in English language only, and we will take up your questions towards the end of the session. And do not post any kind of marketing and promotional messages, and please be polite in your communication. Any participant not following the above will be removed from the session. So let's welcome today's program expert, Dr. Rishi Vardhani. She is an fertility wellness consultant. Plus, she has many happy clients and 9+ years of clinical experience. She's also a founder of Beyond Birth Naturopathy, and she is a natural birth expert, holistic pregnancy care, prenatal yoga, and childbirth education. So, welcome, Dr. Rishi Vardhani, and thank you for guiding us on this free masterclass. The
Thank
session
you
is
so
over to
much.
you.
Great. All right. So let me present my screen, Anjali. Yeah. So good evening, everybody. So I'm so thankful that you have joined this program for getting some insights about improving your fertility naturally. I'm just presenting my screen on my masterclass presentation. So this session is all about the introduction. See, even if you are looking forward for the programs which is forthcoming, this session stands to be the introductory because this has got some inputs on why you have to try naturopathy in the first place as well. All right, let's get started. I hope and wish each one of you a very amazing fertility journey with with naturopathy as well as naturally, and let's seem to improve the journey in a very positive way. All right. So moving on, what would be covered in today's session is all about, the overview about the session is infertility, which is going to be a comprehensive overview. And from the naturopathic perspective, how are we going to understand infertility, root causes, and what is the manifested symptoms we are experiencing, and what is the importance of accurate diagnosis, as well as why is this conventional medicines on fertility is impact how and how why it is impacting, and why is naturopathy a missing piece? All of these will be covered in today's session. So, to begin with, infertility, a comprehensive overview. Actually, when are we considered infertile is because, this question is quite triggering because many people have the assumption that once you have, tried for conception more than a year, having an unprotected intercourse and all that, that is when you consider yourself infertile. But naturopathy has got its own standpoint because we have to tell you that basics have to be with naturopathic concepts. So basics is about the lifestyle and about the diet and all of this in the first place. So that is the basic naturopathy does. And we have other interventions also. We will be proceeding with all this. Say all of that. The beginning is always a little bit confusing with naturopathy and all that. Even the same with the proper presentation as well. So when are you considered infertile from a naturopathic standpoint is when you try changing your lifestyle, changing your diet, changing your overall routine externally, so the internal functions can take place all by itself. And then also you are not able to still conceive, then you are considered infertile. So basically, try with naturopathy for 3 to 5 months. Even then, if you're not able to conceive, at that point of time, we may take an understanding or interrogative diagnosis, then we can come to a conclusion. Most of us who are considered infertile are not suffering with any kind of infertility or fertility issues in the first place. All right. So I really wanted to confirm this in the very first beginning of the session itself, that you are considered infertile when you try naturopathy more than 3 to 5 months and then unable to conceive. All right. So mostly 70% of the couples trying to conceive will conceive at one point of time within the basic concept itself. All right. That's the concept of, putting that point here. And how infertility in India. See, in India, India is considered as a very, fertile land in terms of climatic conditions, in terms of temperature, in terms of, food, in terms of lifestyle. Sunlight is there all the way 24 into 7. And, I'm talking about the days, all right, roughly compared to Australia, abroad, and all that, other countries. In India, it's really intriguing how people are suffering with infertility because we have the healthiest of the climates, we have the healthiest of the soil, we have the healthiest of food, and still people are suffering with fertility issues is a big question. All right. So I think this fertility issues are, self-introduced. I would say we are doing something for ourselves, maybe with urbanized cultures or stress-oriented lifestyle. We'll all deal about, everything in the subsequent slide as well. But India is a very fertile land, and the very question how people are suffering with fertility issues, even in a country like India, is still intriguing. All right. So the third thing is the three factors, which is your cause, diagnosis, and treatment choices. We will be dealing with all the three in detail. All right. I'm just telling you that this cause, if you don't know the root cause of your ailment, we're going to suffer. You actually might be suffering with any other condition, very simplest of the simplest condition, and you consider yourself infertile. For that, you need to be diagnosed. And the treatment choices, there is a kind of strategical treatment choices. And the first has to be naturopathy. The first step towards your fertility, improving your fertility or your infertility treatment should be naturopathy. It's a kind of suggestion from our end because, no people try that. That is the reason why I've included this cause, diagnosis, and treatment choices in detail in subsequent slides. All right, infertility and naturopathy. So I just got a question from one of my clients. Why, if you think naturopathy is improving or helping couples conceive quickly also and also positively, why don't people try naturopathy first? And why do they opt for allopathy or the conventional systems like IUI, IVF, and all that in the first place? She asked me that question. So I just wonder, this is actually why is it dormant in the treatment of infertility is because you need to work towards yourself. There can only be a right guidance. Okay, with naturopathy, this right guidance. You need to work on yourself, and this is one point. So you need to work on yourself, effort oriented. Whereas in allopathy, conventional systems of approach, medicines will do the work, doctors will give you the injections. You will only have to be present. All right, here you need to be present for yourself consistently, effort oriented. The second thing is time oriented process. You need to have patience. All right. Patience is something very, very lacking. You need people are looking forward for an overnight improvement, which cannot happen with naturopathy in the first place. All right. That is why this is time oriented and effort oriented. That is why it is dormant in the treatment of infertility. I consider that. If you feel that, okay, I am considering myself, I have time, I have the effort, I can give my effort, I can definitely give my time, and I'm patient towards this treatment approach, then probably you can actually try in naturopathy as well. And naturopathy is not an option. It's, I think, a responsibility many of us miss. All right. So, saying so, I'll move forward with understanding infertility from naturopathic perspective. So, whatsoever, whether it is infertility or diabetes or any kind of condition which is chronic, okay, diseases are never sudden. Even if it's a heart attack, it is not a sudden one. Diseases are never ever sudden. That's what the toxemia theory explains. The book called Toxemia by J.H. Tilden. All right, this will explain you how this toxemia theory is totally relatable with our disease conditions. Diseases are never sudden, and we become the author of our own diseases, our own health. If you're healthy, you own your health. If you're diseased, you own your disease as well. That is what the toxemia theory explains. And I have a very good, thing to explain about the toxemia theory in the first place. See, toxemia in naturopathy, we call that as over acidosis. It's not about the gastric issues or the ulcer you suffer. It's about each cell getting toxic with extra, maybe you call that toxin. Toxins are not considered, in the kind of chemical or something like that, but extra accumulated, overall not eliminated waste products settled in the body is what making us over acidic. Okay. So it is not about the, again, gastritis or ulcer and all that you suffer, but it is a symptom. Gastritis or ulcer, if you suffer from it, it is a symptom that your body is over acidic, and you can feel it from the sources of the condition itself. All right. So, toxemia theory, the theory explains that your diseases are never sudden, and it has got its stages, like stage one, stage two, stage three, like that. It's got its stages. All right. So, only it progresses with stages. In fact, it is just like, stage one, where you're becoming innovated in the sense we lack vital energy. So we observe ourselves that we are not connected with nature somehow. We're lacking that connection. For example, if it's for water, we are dehydrated. All right. And if it's for food, we are not taking adequate vital energy from the food. And the food itself is lacking vital energy, which has to provide you energy, is lacking energy. That is the saddest part. And the third thing, we are not connected to the sunlight in any chance. By any chance, we are out of connection with nature. And that is the sole cause of lacking vital energy. If you lack vital energy, that means you lack connectivity with the nature. Sometimes no grounding, no connectivity with nature makes us, lack vital energy. That vital energy, what we call that energy or vitality. So if that is lacking, then the second stage happens with toxemia, which is toxin accumulation. For example, this can be given, and I'll explain you with an example. We have a cupboard, all right, and it can store some 100 products, but we have 1,000 products. What we would do? We might actually combine these things and put it together and just crumble it and move things aside, put it somehow, maybe some 700, 800 can fit in. The other 200 products, maybe we'll keep it above the cupboard, below the cupboard, put it in a bag and keep it like that. So this is how toxin keeps accumulating. And one fine day, you feel that, okay, this is too much for this cupboard. And you think, okay, let's throw it out. That's stage three, which is irritation. The exfilling of extracellular space. That's in this third stage, what happens? You will be actually filling up the extra spaces above the cupboard, below the cupboard, putting it in a bag and all that. Slowly it gets accumulated in the second stage. And in the third stage, becomes over accumulated. That is this time where you feel like, okay, throwing things out. All right. So what do? You will try to eliminate one by one, which is not needed and all that. Like the same way, in the body, we get accumulated with toxins. And in the third stage, when you come, your body becomes reactive. What happens is you will get fever, you will get some cold, you will get loose motions. You might also get some vomiting and all that. But what we do, we think it is some kind of body getting suffered with some kind of disease, so you pop up a pill. What is body trying to do? It is trying to eliminate, it is trying to react, show you some reactive phases, that okay, your body is a little bit toxic, support yourself. But what we keep doing, we try to suppress. Okay, you're trying to put the things away and somehow think that okay, things are very inclusive, you're trying to fit in the pace again. So that's what is happening in the third stage. And in the fourth stage, you feel so inflamed. What happens? Your body is trying to push out all the toxins. You're not allowing, and you suppressed it already by taking a pill, or by some means you are suppressing it. If you get the loose motions, you pop up a pill and stop that. If you get vomiting, you take antiemetics, the vomiting medicines, and you stop it completely. So that way, you're not supporting the body's cleaner process. And fourth stage, it leads to inflammation. It's itis stress. There's a connection with all of this as well. If you ask me, the third stage is where your period blood gets, overwhelming. Oh my God, it's so much. What is happening? And there's no period at all sometimes. So you get it like inflamed condition. What is happening? So you will completely come to a conclusion that your body is not reactive, but getting diseased over and over again. And finally, it becomes ulcerated. So that is a time when your skin pops up, all right, trying to eliminate by other channels. For example, you are suppressing completely through the natural channels. Natural channels is like through your anal opening, urine, and sweat and all that. So now everything is stopped. You're using antiperspirant and all that, just telling you. All right. And then you somehow stop that cleanup process. Now the body is becoming, finding ways to expel those toxins out through skin. All right. And then finally, even though you don't support it through the skin, it becomes indurated, or it becomes hardening of the tissues like cyst, or it could be like a fibroid, or it could be like an adenomyotic change and all that. So like that, it becomes indurated, and finally comes to a conclusion that okay, this person is not going to be supportive anymore. I will make this person into a survival mode. When the body becomes survival, in the sense, all the extra highly important mechanisms are alone taken care of. Reproduction takes the back seat because reproduction is not needed, right? So the first thing is you become survival, heart, lungs, kidneys, eliminatory mechanism, everything works. But when you take up this, reproductive functions, hair, skin, nails, all that goes off. That's because it is not needed for survival. So it takes the backseat. So body keeps, however, working towards restoring this balance. What we see as infertility, obesity, hormonal imbalance, cancer, heart disease, all this, see, I'm just connecting the trees, right? I'm just connecting the link. The root cause might be fear or stress, inflammatory imbalances, and detoxification imbalance, your toxin accumulation, and structural imbalances. Sometimes it starts with gut issues like digestive imbalances, all of this. And it could be, autoimmune conditions like Hashimoto's and all that, thyroiditis. So it is just that if you observe this toxemia theory, it definitely keeps telling us that we are the author of our own disease as well as our health. All right. So that is what is explained with toxemia theory. And if you take about the stress-oriented poor lifestyle choices, and that also causes hormonal disruption. See, we are basically wanting to take better care of ourselves. Sometimes we are oriented with taking poor lifestyle choices because of our profession. Might be we need to go to office or work by 8 o'clock or 9 o'clock, the maximum quicker, and we are not able to juggle up with cooking and stress or with the profession as well. So that itself is a main cause. So that is why I've just mentioned stress oriented, which means you're also wanting to take care, but you're not able to take care, and stress is also overclouding it. Stress oriented, poor lifestyle choices, poor lifestyle choices, which includes your food, eating style, as well as your timings and everything, right? And hormonal disruption. Hormonal disruption, I'll just show you. Yeah. See, as I rightly mentioned, we are the author of our own disease. Look at this hormonal disruption chart. Okay. So we are very closely associated with this. We are we already have lost connection with nature, But we are in very big connection with biphenol, flame retardants, phthalates, using whatever products you use, or even the water bottles, it's BPA, biphenol, and PFAs, phytoestrogens from the food and all that, pesticides. Even the foods are become a little more complicated nowadays. So, and we complicate it by taking a lot of canned preserved foods already. So, whatever we take, even a milk or something like that, it's going to be preserved. All right. Egg, it's going to be altered, okay, adulterated. Cosmetic products, many of us are in the trend of using a lot of cosmetic products unnecessarily. We'll be at home, still use a lot of moisturizers, still use perfumes, antiperspirants, and that contains a lot of phthalate and bipheноls, sulfates, and all that. You even your soaps and shampoos, you may think that, okay, I'm using it for a long time, but people keep changing soaps also. Soaps also contains a lot of bipheноls, sulfates, and all that, which is somehow entering your skin, right? Your skin is it's an organ actually. Your skin is a largest organ. We keep absorbing and eliminating waste or absorbing something through the skin as well. So shampoos, so packed water bottles. Nowadays, in addition to the shampoos, we use conditioners and again some kind of foamy substances, serums, and all that, which definitely makes sense. And yeah, of course, sometimes you cannot be avoiding all of this as well, but you can choose products that are less in phthalates, less in biphenyls and sulfates and all that. Packed water bottles. Wherever necessary, we can bring our own bottles, but it is necessary that we avoid all the plastic water bottles, even our own. Plastic water bottles and all that, medicines, menstrual products, everything impacts. So medicine impacts the hormones, and sometimes you take one medicine to impact one hormone, the other hormone get disrupted. So steroids. So all the medicines will definitely have an impact on the hormonal disruption as well. Even the menstrual products we choose, all the disposable products, and sometimes you use organic products, sometimes you use a normal disposable product, whatever you choose, it has an impact on the hormones. All right. And the third one is inherent weakness. I would say inherent weakness cannot be changed, but we can. The point of why I've included this inherent weakness in the slide is because we cannot change our inherent weakness anymore, but we can prevent the same weakness to be passed on to the next generation. So you can take this as an example. Our grandmothers were there, our grandfathers were there. Have you seen them, their strength? And have you seen your dad's strength, your mom's strength? And are you seeing your strength? We've been reducing, right? Our strength was exceptional. I mean, a grandparent's strength was exceptional. I could tell this with very simple example. The vessels, right? The spoons and the vessels which my grandmother used, I couldn't even lift it. All right, that is my inherent weakness. We've been passing on this generative weakness, and it should come to an end. It was actually happening for the past 2-3 decades just because of a lack of awareness. Awareness is one side. It was they were unaware of their health, and they were like giving in for urbanized products and all that. That was the reason why we are becoming inherently weak. But if you want to stop this and make the next generation a little bit stronger than you can make that happen. All right. So that is why it's called, I've included that inherent weakness just to prevent it from actually passing on to the next generation. All right. So root causes versus manifested symptoms. So this is something like, I would say what is actually seen on the outside is the manifested symptoms. For example, people might be having irregular periods. People might be having, maybe, let me consider having an irregular period. Let me tell that, it's just that manifested symptom. Some other condition is happening inside. Its root cause is different. It might be ovaries giving up, or the endometriosis problem, or, the endometrial problem with the lining of the uterus. We will never know. And it might also start from the vitamin deficiencies. Say, for example, nutrition deficiencies, and we feel that it is fertility issue in the first place. And says who? Like, doesn't know. When you test it, when you test your vitamin B12, when you test your vitamin D and all that, it will be considerably low. See, for example, I'll tell you this one example. Okay, there's this vitamin D deficiency. All right. And vitamin D deficiency, vitamin D is something like a hormone in itself. Even if it's called a vitamin, it's called a hormone. All right. This vitamin D, if it is low, you cannot produce good hormones. Good production of hormones is not possible with vitamin D. I can tell you this with one example. Again, one more example to make you a little more, aware and little more alert. All right. So we are making this sweet called kesari. We know this kesari, right? It's a sweet. All right. Very common in South India. I don't know how it is there. All right. So we are making kesari, but forget to add some sugar. We don't add sugar to the kesari. What happens? It looks like kesari, but it is not a kesari. Just because it is a sweet and we forget to add that sweet, all right, the sweetening agent is missing and we cannot call that a sweet anymore, isn't it? So likewise, we make a hormone, maybe that we call that estrogen, but it is lacking in vitamin D, which is a very essential component. How will we call this estrogen now? It is estrogen, it is a hormone, but it's lacking vitamin D. How can it be vital? How can it perform its function? So you have that one scoop of kesari you made without sugar. It is just looking like kesari, but when you taste it, it's not sweet. The same way, it's a hormone that is being produced, but not a hormone in its whole form because it cannot perform its function. Once this hormone is not able to perform its function, the other following processes suffer. It starts with micronutrient deficiencies or nutritional deficiency in the first place. And this might be oriented with hormonal imbalance. I told you there is a hormonal imbalance. And that hormonal imbalance, imbalance in the sense by taking the poorer vitamin D, we don't have vitamin D in the first place. Very lacking in vitamin D's and vitamin. I'm just taking the example of vitamin D. It might happen with magnesium, it might happen with vitamin B12, vitamin A, E, and all that. Sometimes people are running without a pause. All right, that might be also be a very stressful factor why we have all these kind of issues in the first place. So then we have the hormonal imbalances and irregular menstrual cycle. Irregular menstrual cycle is not the actual problem. Hormonal imbalance is the actual problem. So the root cause is the hormonal problem. It might be because of various reasons. One of the things is nutritional deficiency. Okay, it might be starting from the gut as well. You either take over calorific diet or take diet which is completely nourishmentless or nutrientless. So you're taking over calorific as well as nutrientless diet. And there's one more condition where you don't observe these, food, vitamins, minerals, and all that basically in a good level. That's because your intestines is clogged or you're over acidic or over toxic. The cells are not containing extracellular spaces to absorb and perform its own function as well. So they are completely toxic. That might also contribute to hormonal imbalance. And what you suffer, you manifest the symptom as irregular menstrual cycle. And that. And then the irregular menstrual cycle, you have this polycystic ovarian syndrome or polycystic ovaries, which is actually, we need to improve on the functions of the ovaries, isn't it? If you're only working on the irregular menstruation by taking up pills and all that, you'll only have that condition sorted out for time being. After some time, it pops up. Or it is just clouded by your medical impact. It is just symptomatically you're approaching. I'll be talking about it. You will be having acne and all that, but the underlying condition might be PCOD. And there's this recurrent pregnancy loss, and you will never figure it out why it is happening in the first place. It might be immune system disorder. And pelvic pain. If there's any pelvic pain during the intercourse or generally as well, and you experience, fertility issues, it might be endometriotic condition as well. So over toxic and unexplained infertility. You're just over acidosis. You're just suffering from over a condition called over acidosis, which is bodies experiencing a lot of toxins. Okay, so it is just popping it out. You don't know the reason for the fertility as well. So that is why you're just focusing on the manifested symptom. You treat only the pelvic pain. You're forgetting to treat the endometriosis. You're treating, there's some difficulty in conception and you're not figuring it out. Maybe your diagnosis is a mistake there. And you sense there's a fallopian tube blockage. It's very difficult to understand the problem after you have gone to a lot of extent. All right. So it is better that you find the diagnosis cause first. The cause Without understanding the cause, there's no cure. All right, the cure is in the cause. If you know the cause, you can probably easily cure it. If there's kind of a vitamin deficiency, you can actually take up some, eliminating diet in the first place, and then carry on with a constructive diet along with some supplements in that condition, in that phase of time, and then get better. You need not suffer from annualitary cycles. It is ovarian dysfunction. You need to work on the functions of the ovaries in the first place. You might be unclear about all of this because of literally medical terms and all that, but I don't want you to understand as such. What I really want you to understand is you experience some symptoms, all right? But the cause is different. If you understand the root cause, then you don't have to experience these symptoms at all. You will get the cure. That's what I'm trying to explain. If you are accepting that much or understanding that much, it's great. Proceed forward with the significance of accurate diagnosis. See, once you take the diagnosis, many people are very skeptical to take a diagnosis because it is a bit costly as well. All right. So it is costlier than usual. And sometimes it exceeds your treatment cost. So, but no other choice. We need to understand our condition, self for yourself as well as for the doctor as well. See, even if you come to me as a naturopath, I would request your diagnosis because I might come to a overall conclusion of what you are suffering from. But if I see the diagnosis, I can match up, okay, my levels of understanding of your condition according to the actual condition. We can combine that and give you a better personalized treatment planning approach. Okay, it might be your problem. We can give you that personalized approach according to the condition you suffer. And sometimes there's a chance that you might be getting treated for something else, but the actual condition is something else, minimizing the misdiagnosis. And I will be giving you unnecessary treatments for the same. See, it might be some kind of debris, okay, like in the sense endometriotic cyst in the right side of the ovaries. All right. And you are getting treated for the irregular menstruation. You think the problem is hormonal, but the actual problem is endometriotic cyst. Until you find out, we will never come to know. Just give me a moment. I'm sorry. So, yeah. Yeah, I was talking about the minimizing misdiagnosis and unnecessary treatment. So it is very helpful in the first place to avoid unnecessary treatments. And I get misdiagnosed with your condition and I give you some other treatment. So it can be prevented, right? So proper diagnosis might be the foundation for the effective treatment. Without it, we are just guessing, right? It's just that merely guessing in the dark and understanding the root cause. So we will have an integrated and meaningful healing. If you understand the cause and clear with your diagnosis, we can get through it. All right. So better do the diagnosis if you are suffering from any kind of you think if you are suffering from any kind of fertility related issues and all that. So yes, the impact of conventional medicines on infertility. See, we are just assuming there's a manifested symptom. There's a manifested symptom. We don't, okay, let's take it as irregular periods because many of us suffer from PCOD and irregular periods and all that. Oh, we can take that as an example. Okay, we have an irregular periods and the cause is unknown. And so we have some kind of hormonal treatments symptomatically approaching it. So I have an irregular periods. Now I'm bleeding for 5 to 7 days at a stretch and my periods were missing for 3 months. Now I'm getting periods, okay, for continuous of 7 to 8 days. I'm trying to manipulate that hormonally and stop the periods for now. All right. And what happens after some time? We don't get the period. Again, we are trying to take the hormonal pill to get the periods down there. All right. So actual cause is unknown. What is happening inside? We don't know it. And symptomatically, we don't get the periods. So we are taking the pills to get the periods. Once a period happens, it is actually prolonging And for that, we take one more treatment. So, like that, it continues. We are just symptomatically approaching the manifested symptom. All right. And the common medical interventions, maybe you consider that, medical, some medical interventions. Uh, we also term that, okay, let's take medicines, 21 days pill, okay, contraceptives. So tell me one thing. I'm not against any kind of medical, methods of treatment, allopathy, conventional, and sometimes I integrate the treatment. But it depends upon how we are looking at it. Now, mainly for a person who's actually suffering from irregular period, I'm taking that as an example, okay, because everybody are aware of it. So we are having an irregular period, and we are put on 21 days of contraceptive pill, and you are all equally trying to conceive. See, how is this logic? So you are trying to conceive, and you are put on a contraceptive pill, all right, and then you get yourself cured with PCOD and all that. I'm not. It's not going to get cured. It's just symptomatically approached. All right, there's no cure, and you're given this medical intervention of 21 days pill, intervening your cycle over and over again. Okay, 1 month you're taking it, and the next month you're getting it better, supporting yourself naturally, good, great, taken care of. Second month you're taking again the same kind of 21-day pill and waiting for your periods. Okay, fine. Maybe in a lifetime, 2 months of intervention is not going to be making a change. But that's happening over and over and over again. And in the third time, you won't even go to a doctor. You will pop up the same 21 pills because you become the doctor of your own self, because that's happening. I'm not telling you that's not happening. It's happening. Most of them are taking those OA cure, OA plus, and all that, the progesterone pills and all that, all by themselves, all right, to get them the cure. So these are the common medical interventions. You get the pill, you get the outcome. That's it. So I'll tell you, there are medical interventions. Some of the medical interventions are ovarian drilling, ovulation induction. When you're trying to conceive, you might be trying a lot of follicular study and ovulation induction. And I'll tell you one thing. See, medical interventions are taken when it is required only. First place, you try basic changing your. See, actually, PCOD, when it comes to PCOD and irregular menstrual cycles and all that, it is basically a lifestyle problem. Even though if it's a thyroid and all that, it's a basically thyroid. It's a lifestyle problem. Okay, when it is highly required, we may get in for the ovarian drilling. It's the last step. On ovulation induction should be preceded by some kind of lifestyle change, at least a diet change. If not, it will not work. So you induce the ovaries. What you think you do, you are trying to induce the ovaries by giving a medical impact. You're just taking some medicines to induce the ovaries to produce eggs, because your ovaries are not producing eggs. They are anovulatory. And we are studying that through follicular study and all that. We are trying to induce the ovaries. That's called ovulation induction. And by that way, your ovaries will start producing. See, in the place of producing 2 or 3 eggs, maximum egg, or in the maximum 2 or 3 eggs, it will start to produce 7 to 9 eggs. All right. First cycle, you're doing ovulation induction, 7 to 9 eggs. Second cycle, 12 eggs. Third cycle, 14 eggs. And finally, in the fourth cycle, when you do, it becomes completely drained off. That's called ovarian hyperstimulation syndrome, OHSS. All right. So you cannot also be very continuous with the medical interventions. When it is required, we do it once and wait. Wait for at least 2 months. Your doctors might be in the idea that, okay, you are supporting yourself. See, it is basic concept and basic responsibility that you support yourself. And then doctors will be taking care of the other medical procedures as well. Even if you are in the process of taking this ovulation induction, the IUI and IVF, please try naturopathy alongside. That is what I'm meaning. It's not about what you are talking is not in sync with my kind of treatment approach. It's not about that. We're trying to improve the basics of your health and then try a treatment approach. In terms, if it can work, it works best for you, isn't it? You are becoming positively influenced by all the lifestyle and basic lifestyle changes as well as diet. All right, I will explaining you as well. So the biochemical changes that can't be triggered with medicines. Let's take one example. Okay, let's look at this one example. See, whoever attending this session, I don't know what you're going to get from this session. All right. But I want you to attend it till the end, okay, to understand at least how this concept of naturopathy works. All right. So it is okay that you have lots of doubts, and you can actually ask me when the session is complete and all that. But I want you to just stay back till the end of the session to understand what we are at least trying to put forward. Because nobody can easily take up a free session. When it is given for free, it is completely underrated and unvalued. All right. But I guess this session is going to be a kind of a light on your path towards your conception. All right. So come on, let's look at this one example. How is this body biochemical changes happening in our body? See, our normal vaginal pH, I'm talking about the vaginal pH right now. So it might be 4, 4.5 and all that, which is slightly acidic in nature. If it is not acidic in nature, what happens is all the microbiomes like fungus, bacteria, and all that comes and kind of lives there, isn't it? So we must be aware that the vaginal pH is slightly acidic. Okay, exactly at the time of ovulation or around the 14th day or 15th day, like that. It's not, see, ovulation also is not taking place exactly on the 14th day. It might be taking place around 15th day or 17th day, also sometimes, even later than that, or even before 13th day, 12th day, also. It depends upon everybody, I mean, everybody's condition. It depends upon person to person as well. Even one person ovulating on 14th day on one cycle will not ovulate on the 14th day at the other cycle. So the 14th day is just a concept. What I'm trying to tell you is when we are ovulating, there is a slight decrease in, I mean, the increase in the vaginal pH to alkaline acidity. I mean, alkaline pH. That is because the vaginal pH is changing its biochemical process to receive the sperms. All right. So this is FSH or LH surge. The same time when the LH is surging, the normal vaginal pH will become sometimes 4.5 to 5, changing the entire pH into slightly alkaline nature, that is to receive the sperms. And that is a time when the body becomes overly secretive as well, to wash off the area then and there. These are all amazing biochemical changes that can't be triggered with medicines. Medicines are needed when they are highly, we can't push it further. That way, we can take the use of medicines, but it is not the first step or the final step. All right. It is just the uh, strategical step in one of the ways that you get fertile. That's it. Right. So this is just one example of how your body can actually, take you through as well. All right. So you look up this naturopathy, as this is one piece in the treatment of fertility that's missing. That's naturopathy. So the missed preconception phase. Many of them are jumping into treatment approaches without actually considering this preconception phase. The preconception phase is nothing but the period of 3 to 6 months before you actually conceive. That's a planning. The point when you plan for conception, it should be 3 to 6 months earlier, and conception should take place 3 to 6 months later. The between phase is called the preconception phase. So, this preconception phase, whether you are suffering with any kind of fertility issue or not, all right, if you are married and if you're planning your pregnancy, then this preconception phase is something which is your responsibility. All right, the hierarchy of treatment approach. I told you already, there's this naturopathy completely missing. So the first step in the fertility treatment approach should be the basic modifications of your lifestyle and diet, basic naturopathy. We call that basic naturopathy. The next step is naturopathic interventions, where you take this hydrotherapy like hip bath, acupressure, acupuncture, and some kind of mud therapies and all that. Naturopathic interventions are required. All right. And then the third phase is where you take an integrated approach. Integrated approach in the sense you take naturopathy as well as you take this allopathic approach, treatment medical approach. After following at least 3 months of naturopathy, you get into an integrative approach. That's the next hierarchy of the treatment. And then finally, if you want to get into an IUI, then you will have to follow a period of at least a month of naturopathic intensively and then try in an IUI. where your periods are actually regular and normalized and all that. You'll have to better cure your lifestyle issues naturally. For example, if you have an irregular period and try to get into IUI, it is not going to work out. Even if it's work out, think about the health of the babies, right? You need the more people are wanting conception, all right, they should want a healthier baby as well. They are just giving a very subtle attention towards the health of their babies. They want a baby. As much as they want the baby, as soon as possible, they are kind of, I should say, least worried about the health of the baby because they're not aware of it. Okay, so awareness is not transformation also. You get a lot of awareness, you get to have the diet charts, you get to have a lot of lifestyle changes in the next see, this is a master class where you can understand why this naturopathy is important and all that. See, awareness is not going to transform you directly. All right, yes, you understand that, okay, this is a point of realization. Yes, I need some transformation. So that this is a kind of an awareness thing, but you need to transform, and that needs guidance. It might be a kind of educational session like this, or a type of personalized approach that cannot be put forth. It depends upon you, your kind of perception, your kind of needs and requirements. All right, but getting aware will not bring you just transformation. And IVF cannot guarantee you a baby as well. So when you are trying an IVF, it is just a trial. When you can wait for that expensive trial, why don't you try an inexpensive trial with naturopathy? IVF cannot guarantee a baby just like that. It needs your basic support, basically, at least 3 to 6 months of naturopathy, and then try that time. You might not even need an IVF or an IUI. You might get pregnant naturally. Who knows unless you try? When you never try, you will never know. All right. That is something which I can keep telling my clients very frequently. And see, here are some positive, things on how I've not just introduced a lot of people and all that. I mean, a lot of case studies and all that. Just 3 case studies, which I found a little bit impactful. Some of you might be like having this kind of AMH is one such condition. I have a lower AMH. Can I try naturopathy? Natural conception can be tried. So it depends. So this women with 34-year old women with hypothyroid, endometriosis, blocked fallopian tube, AMH as less as zero point 0.8, and previously miscarried. I think she miscarried twice and had 2 failed IUI, 1 failed IUF. Ultimately, she conceived naturally in 11 months. And that also only with naturopathy. She never wanted any other treatment approach as well, but she waited for 11 months very stubbornly, and she needed the right guidance at right point of time. That's it. All right. She was under 35 years. For 35-year-old women with so many line of issues can conceive naturally. Just one of her cases, right? And I also tell that just because it happened with that woman, it doesn't happen with you also. But it's just telling you that, okay, even with AMH as less as zero point 0.5 and all that, we can try naturally. And AMH is not going to increase like tremendously, like from 0.8 to 2 and all that. It might improve from 0.8 to 1, might be like plus or minus 2. But what we want is just one egg for the conception, so that one egg can be impacted naturally. All right. So the second case study tells you that the 41-year-old woman with pre-planned dates for embryo transfer. All right. So she had an embryo transfer date planned already. Only 1.5 months later, and she's in 41 years. I'm just taking the cases which have shown positive improvements in a very odd conditions. That's why I'm telling you here. They are just having these kind of conditions to only that make you okay feel that naturopathy definitely works. Okay, and she tried integrative naturopathy. Integrative naturopathy means she's been taking all the other medicines along as well. In 1.5 months, she had a previous IVF failure also, and she's been trying to conceive for 13 long years. And the first time when she came to meet me, I just explained the odds of the treatment. I didn't tell her, give her a lot of positive approach or something like that. I told her there's a lots of odds in trying for naturopathy, but anyway, this is going to be your last chance. You try alongside. Might be you find a light. That's it. And she conceived with twins. She delivered via cesarean section at 35 weeks, but the babies were healthy. All right. They are healthy even now. I think they are almost 2 years by now. So she delivered at 41 years, twins. And 13 years of conception journey, and of course, her previous IVF failed and all that. She's trying the last ever chance with naturopathy. I didn't tell her, I didn't promise her that it'll work and it'll give them effort and all that. She only followed it alongside, maybe as a kind of a supportive tool. Naturopathy itself, she took it as a supportive tool. That's it. At least that. And third case study is just 31-year-old woman, hemorrhagic cyst. And she had a gallbladder polyp, which was indicated for cholecystectomy. In the sense, she was indicated for the gallbladder removal. Since she did not have money to do that operation, 80,000 that time, almost 9 years back, I'm 32. All right, I might be looking a little younger, but I'm 32. I'm talking about 8 years back scenario where she did not have that much of money for going in for the cholecystectomy surgery. She approached naturopathy. All right, after 9 months, her cyst was also, I mean, the hemorrhage cyst was also vanishing and polyp was also gone. And she was intense detox, having an intense detox, and acupuncture was done and all that. But money matters. That's what I really wanted. People who have money just fall in for this IUI and IVF multiple times, but they don't wait with naturopathic approaches as well. In terms of money, the charge where we charge through naturopathy is just the guidance and the effort and time we spend on you. All right, it's really our time that matters a lot. I, as a naturopath, very feels often that time with the doctor. See, one doctor can handle 10 clients, all right, at one point of time. See, it's just 15 minutes of time with one doctor where you don't even understand your condition. We wanted, as a naturopath, we wanted to bridge that gap. That's it. And naturopaths are there handling clients more frequent than the allopaths as well nowadays. But we get that time which is relied on the client as well. So we spend a lot of time understanding the client issues, making the client understand basically what their issue is actually. Once they have the cause, diagnosis, and the better treatment approach, they have the fertility issue sorted out. And they finally come to a conclusion that they don't have any kind of fertility issues as such as well. All right, these are some of the case studies I just wanted to exhibit in front of you. See, transform your health with naturopathy. It can happen actually. We need to analyze the root cause of the issue, and maybe you can opt for the. I think as I told you, I just request you to stay back till the end of the session to understand what we have for you, and proper treatment planning, consistent lifestyle orientation, and all that. You need to have a practical but a sustainable dietary change, not a major. Say, if I could give you like mueslis and avocados and all the higher food stuff, nuts and all that, many people don't follow that. Might be because of time oriented constraints, as well as not able to buy those things sometimes. So it should be a very sustainable household daily routine that is easy to follow as well. And you must be aware of the natural therapies that can be done at home. Reevaluate your menstrual products. There are a lot of menstrual product options nowadays. Advanced naturopathy like acupuncture, moxa, and all that traditional Chinese medical concepts. So integrative care, whenever you require, we will be indicating you. So at least in naturopathy, we won't waste your time. Many people think that, okay, if in case I opt naturopathy, I might be having a little bit of, yeah, I might be having a little bit of time wastage here. Why to try unnecessarily with naturopathy? We'll go directly into IUI. But the 3 months you spend with naturopathy can influence your treatment impact. Okay, it can influence the positive outcome of your treatment. For example, if you're trying in an IUI after 3 months, now you start with naturopathy. Either you conceive naturally before you get into the treatment, who knows? The next thing is when you get into an IUI, you'll get the positive treatment outcome. There will not be absolutely any, weakness or inherent tendency of weakness with the babies as well because you've been preparing yourself. There's chances that you are not able to conceive naturally due to various reasons, but it helps. So naturopathy focuses on those daily, consistent efforts, little efforts, like, uh, consistent effort towards yourself. It's not late to begin right now. All right. So this is what we help you understand with, and some of the expected results. See, foundation for the treatment outcome as well. When you choose naturopathy, you have the improved fertility because you detox, and you have the better reproductive organ health because now your body might be in a survival mode. Maybe when you actually focus on naturopathic approaches, your reproductive organ might gain its vitality back, So better reproductive organ health and positive treatment outcomes. You have a better mindset. Okay, why not me try with naturopathy and have the same mindset transfer to the baby as well? Your oriented immune system functions, restoring the hormonal balance, which is very essential. Even if you try for an IUI or IVF, right now planning, right? If your period is not on track, it is highly impossible to get the baby's health on track. All right? Regularized menstrual cycle, of course, the quality of eggs. And we equally focus on the partners as well. Whatever approach we do, we equally focus on the partner. If it's the men's session, we equally focus on the women as well, involve the women. And if it's a women's session, we equally involve the men as well. So this is the expected result when you find, naturopathy, follow naturopathy alongside. All right. So always that wise people take right action at the right time. And I guess this session have at least rekindled the fire that's inside of you, wondering why to actually offer naturopathy, whether naturopathy can help, or what am I doing with my treatment? Am I going in the right direction? At least some of the questions might have been answered. And right now, I'm just handing the session over to Anjali. So, but I'll be taking up the questions eventually when the session completes. Stay back to the end. I request you. Right, Anjali, over to you.
Yeah, so we have a lot of question in the comment section, but we will be answering these questions in a while. But before that, let me introduce to you 21 days natural fertility boost program, which is a completely live program, and it starts from 21st October at 5 p.m. In this session, there will be three live session, and fertility assessment will be done. There will be three weekly diet plans, step by step fertility boost lifestyle and therapies to you that you can perform at your comfort zone from your home. And we're also going to teach you about some yoga therapies, some natural therapies, and diet and detox plan will be provided. The bonus session will be two live session for queries. So how the 21-day program will be conducted? So there will be three live session: 21st, 22nd, and 23rd October, 5 p.m. Recordings of all the three live sessions will be provided. And after these three live sessions, there will be 21-day live WhatsApp group support to you, in that group we are going to share all the resources with you, fertility boosting diet plan, therapies, and everything. Now during the time span of 21 days, if you have any queries, so there will be two bonus live sessions where you connect with Dr. Rishi like this, and you are going to ask your queries and ask your challenges. Now in live session one, there will be fertility explained, there will be trio concept of naturopathy, there will be infertility ignorance, how hormonal disruption affects the fertility, metabolic reprogramming, and self-assessment questionnaire. In live session 2, there will be a complete step-by-step approach. We are going to include the 5 elements of nature to enhance the fertility and simplified strategies for enhancing fertility. And we are going to share the naturopathic diet too. And towards the end of the session, there will be live Q&A. In live session 3, we are going to talk about some couple oriented approach, naturopathic treatment interventions, supplementation conclusion, and again live Q&A session. So like I said, recordings will be provided. Along with this, if you want to join separately 1 month fertility live yoga session, then you can join Dr. Rishi, because she also conduct live fertility yoga session. So there will be 12 live sessions for 1 hour each through the lifespan of 1 month. Fertility yoga asanas for 45 minutes, pranayam breathing exercises 15 minutes. So the yoga live sessions, which are completely separate from 21-day live program. The live sessions will be on Monday, Wednesday, Friday from 6 a.m. to 7 a.m. and recordings will be available for 48 hours only. So if you want to join both the programs at the same time, then the combo offer is at 3,200 and only, where you get two programs in one hand. So there will be 21-day live fertility boost live program, in which we are going to talk about completely about diet, natural therapies, some tips and tricks, and everything holistically. And if you want to perform fertility yoga with Dr. Rishi. Then there is again live session on 3 days of a week, early morning 6 a.m. to 7 a.m. In the 1 month. So the price is this is the discounted price, and offer is valid till tomorrow 10 a.m. The combo offer price is 3,200. But who shouldn't join the fertility life program? So if you are having any severe diseases like depression, anxiety, and you are taking a lot of medication for that, kidney stones, gallbladder, ulcerative colitis, and then all these issues, they need personal attention, and you can come with us for the personalized fertility coaching program, because with these issues, with lot of medication, you need medicines tapering. And in personalized coaching program, Dr. Rishi can give you more of the personal attention. So there will be one-on-one customized program. Duration is of 2 months. Diet and lifestyle assessment, personalized video consultation, personalized weekly plans will be provided to you, and follow-ups call, live WhatsApp group support, which is completely personalized with Dr. Rishi, will be provided. So the offer prices are here. The 21-day natural fertility program, which is starting from this 21st October, 5 p.m. The program cost is only 2,000 if you want to join the fertility boost program only. If you want to come for the one-on-one coaching program with Dr. Rishi, then the program price is 5,040 for 1 month only. And if you want to join for the couple coaching program, then the prices are here. But if you want to join the combo, that is along with yoga, then the combo offer is 3,200. You can scan the QR code and register for the program. The offer is valid till tomorrow 10 a.m. only. So you can register now. I think we can take up questions now.
All right, I'll be picking up the questions. Um, are you going to be there, Ranjini?
Yeah.
Okay. So help me with the
Uh,
question. I'll be like answering things.
okay, so we have this question from Pratima. Does sedentary lifestyle decreases fertility?
Of course, yes. See, what we can control in the first overall thing is just like, we can control only our lifestyle changes. We can control what we eat, how we sleep, and, we can control the external activities happening. We cannot control the internal. We cannot take the rule of the internal functions happening inside. What you can control is your lifestyle, your diet, your sleep activity, all the attachments with the nature and all that is what is in our control. If you control that in the first place, then naturally some fertility issues are taken care of all by itself, isn't it? Of course, it does impact sedentary lifestyle, does have an impact, negative impact on fertility.
Yeah. So we have this question from Fatima. Does endometriosis need surgery to cure, or naturopath works?
All right. See, for endometriosis, we need to try with naturopathy. Maybe you can try a basic lifestyle approach and all that and see whether it is working for you. Because you will have to combine the basics of basic concepts like, some kind of an eliminative diet. I could say the eliminative diet in the sense with naturopathy, there is three types of diet. One is eliminative, constructive, soothing diet, and a constructive diet. You must try an eliminative diet to throw all the toxins in the first place and then attach yourself slowly. That is how this week plan 1, 2, and 3 works. In the first week plan, we give them on an eliminative basis. Second week plan will be like a soothing diet, and third for the conception plan. So that is how we work as well. You can try this program itself. No need to get into any kind of personalized. You can join the session and have the better idea about it. All right. Mm.
Yeah. So we have a lot of questions on AMH. So those who are facing low AMH problem, can they join this 21-day fertility
This
program?
program is especially designed for those who have lower AMH as well as, I would say this lower AMH. If you're having ovarian failure, that is different. If you have ovarian failure, then this program is not for you. But if you still have the lower AMH, still the lower AMH, like ovarian reserve, might be around zero point 0.5 and above 1.5, 0.5 to 1.5. Above, it's good. Your fertility is good, considered good above 1.5. But between 0.5, sometimes 3 to 1.5, 1.8, and all that, you can join in the program.
Okay, so people who are looking for, those women who are looking for improving their egg quality, and who are facing the thyroid level problem and diabetes like issues, they can, I think, surely join this program.
Also, one thing is if you are having thyroid issues and you are being put on medicines, probably you can take a personalized consult because who needs, you're already with an associated illness with thyroid and all that, you're already taking medicines and group programs might not be like very good targeting your approach. So, if you're taking any medicines alongside you want to try this group coaching program, it might not work with you. If you're already on medicines, try a personalized approach. All
Okay.
right.
Yeah.
But
uh,
those suffering from diabetes and all that, even though you're taking medicines, you can join this program.
yeah, so we have questions on autoimmune condition. Megha has asked that, in autoimmune condition, can the person, or the women can conceive naturally?
Yes, autoimmune condition can be like it depends upon the condition as well. If you're suffering from autoimmune condition of Hashimoto's thyroiditis and all that, it is possible to conceive. Like thyroid antibodies might be there, you might conceive. But what is your particular issue? I might not be aware of that. But what is your actual autoimmune disease? There are a lot of autoimmune disease where you can't actually conceive. That also is there.
Yeah. So Megha is saying that she is conceiving naturally, but embryo is not growing.
You are conceiving, you have it, which means you have a chemical pregnancy. If you are actually unsure about your autoimmune condition, you might not be aware of that as well. Sometimes you might be having a implantation problem or problem with endometrial lining. All right, it might not be an autoimmune condition also. And if you are suffering from autoimmune condition, basic movement and all helps. So you must be exercising frequently in a very regular, consistent manner. Exercise seems to have a very good positive impact on autoimmune conditions. I've seen that in many of my multiple clients as well. All right.
Yeah. So we have, let me just take the questions. Okay. So we have the question from short cervix. So
Mm.
naturopathy can help in this condition.
See, cervix shortened is a structural abnormality. For structural abnormality or not, naturopathy cannot help. For example, structural abnormalities like smaller ovaries, smaller uterus. Naturally, the structure itself is deformed. We cannot help you with that. Naturopathy is only for those who suffer with functional disorders, but they can follow lifestyle alongside. Maybe you can't actually treat this short cervix with naturopathy, but you can actually be healthy with naturopathic concepts as well. But your question, not possible. Short cervix is not treated with naturopathy.
There are many questions regarding age. So those who have this age of 45 years, above 40 or 40 or above 30, can they join this program of 21 days? Will it be beneficial for them to conceive naturally?
I would say yes. See, because you would be 45, you might be 45 or 41, might be somewhere in the older age trying to conceive, and you might be not knowing where to begin as well. You've been like landing up with treatments after treatments and treatments after treatments, getting it failed over and over again. You can try alongside the naturopathy. If it works, it works. Let's give it a try. I would say let's give it a try at the age of 45, if you're still looking forward for conception with regular periods, if your period is regular, then you try naturopathy. If you should have some periods at least. All right.
Yeah. There is questions on, that I think, for low AMH, I think we have answered it already, that yes, you can join this program. For those who are, talking about egg quality, so yes, egg quality can be improved. Dr. Rishi has answered this earlier also. Okay, so taking few more questions. Okay, so does traveling daily decreases chances of conception?
Traveling? No, traveling does not. But you know what happens is when you're traveling, your lifestyle entirely collapses. The way you eat food outside. You keep, eat whatever time you want. All right, that all is actually changing, right? That might have an impact on your health, but not otherwise traveling as such. See, as such, when you conceive, the fertilized embryo is just the size of a mustard seed, it might be a cumin seed. All right, that with a protected endometrial lining and all that, will not come in like that, will not miscarry as such because of traveling. But there might be other reasons which is coincidental of your traveling as well. All right.
Yeah. So we have question on. Okay. So we have this question from Anshul that having PCOS and 2 cycles of ovulation induction didn't work, but what could be the cause and what to do to improve?
Ovulation induction did not work.
Yeah.
So you have PCOS. Is your periods regular? So 2 cycles of ovulation induction, okay. Um, you have PCOS. Is your periods regular? PCOS is the actual condition why your ovulation induction did not work. Okay, you will have to reverse this condition. See, conditions like PCOD, irregular menstrual cycles, and sometimes or some hormonal imbalances, vitamin deficiencies, and all that you should stabilize all this before you get into any kind of treatment approach, even before ovulation induction. Ovulation induction is a form of a treatment, and you should come to a conclusion that once you're coming in for a treatment approach, you should have all of this settled. If you have the PCOD condition, how will ovulation induction work? You already have messed up hormones, and you're playing with hormones once again. It might not have a positive impact. That is why it's failed.
Yeah.
You're
So
understanding the reason, right? She's wanting the reason for why.
yes, yes, yes.
Then that
So
might be the reason.
yeah. So Lakshmi has asked this question that fallopian tube blockage can be cured through naturopathy.
Actually, if it depends upon the type of the block, and if you give some time with naturopathy, it kind of channelizes. In the start of the treatment approaches, that is, I'm talking about 9 years back. I'm in the field for 9 plus years from 2015 at least, since I completed my internship and all that. I've started with pregnancy, and naturally, within a year, it led me to fertility, handling fertility oriented issues and all that. So at that point of time, I wasn't aware. Actually, this is like a story. I had my perception about fallopian tubal block. If there's a fallopian tubal block, then naturopathy cannot help. That was my perception about back then. And later on, the same client with a very thick block that couldn't be rechannelized, or even you can't actually visualize through HSG. The same person conceived naturally after 7 months of naturopathic approach. I did not even have an intervention with her. She just continued whatever were discussed during the consult, and whatever she was following for the 3 months, she was just continuing all that. And finally, her tubal block resolved, and she got pregnant, and now she has got 2 kids. One is of 4-year-old, and one is of 2-year-old. That's okay.
Yeah.
Simplifying your answer, so it means it works,
So
but
I
you
think
have to give some time to yourself.
yeah, yeah. So we have this question. I think we have loaded of questions. So
Yeah.
yes, those who are having PCOS, overweight, hypothyroidism like issues, and low MH like problem, they can surely join this 21 days boost natural fertility program, because it will going to help you. We are not going to provide anything, a lot of chemicals to you. Yeah,
Yes. It
yeah.
is
Okay.
actually going to be way more important, and as a very truly a beginner or life changing program before you actually look forward for your conception positively. It's okay. So
Yeah,
it's a first step. It might be the first step. After that, if you want, we can also have a personalized approach. But this program, I can tell you, this one particular program will give you all those things, all the tools with naturopathy you need to conceive naturally. You don't even join personalized coaching programs from there. We would ensure all the things that you need naturally to conceive naturally. Only thing is you need to give your effort. The cost we are taking, like 2,000 that we are taking, is just for the mere availability of the presence, right? Our presence, the program nature and work we've been putting through. We just get paid for the same. Otherwise, it's just the basic. All right. In 2,000, the amount of information you get to conceive naturally is tremendous with the
yeah,
program with us. If you care, if you think you've got something, at least a kind of a little bit of eye-opening thing in this particular free masterclass. It is a free masterclass, but we think a lot of positive approach is changing as well here. Although we didn't give solutions, we are looking forward for those who have that kind of commitment or compliance towards naturopathy. Maybe hardly, I had 200 participants when the session initially began, and now only 60 of you who shows that compliance. And that is what we are looking forward. When a session is given for free, it's not valued at all. So it's just the work charge we are basically charging you for. But when you join, actually you can make or save a lot of money by preventing yourself getting into unnecessary treatment and medicine and all that. At least save your health. It's not about the money, at least save your health. And the product we are going to give you and all that, the idea about the menstrual product and all, they will give you the entire 2000 back also in within 2 3 months. So that is all a very interesting thing about the session. But yes, okay, I have this one interesting question to answer. So I have one autistic son of 9 year old and age is 40. See, 40 years, it's okay that you can try in for conception, but you try naturally. You cannot try in with IUI or IVF and all that. If you try naturally and you get conceived, then it's great. So you try the session, maybe this will get a lot of answer towards you. All right. Yeah, of course, exercise can be done after ovulation because we encourage people to do exercises. That is what makes your hormonal stability in the first place. Never stop exercising after having intercourse or after ovulating and all that. You can continue exercises, and that is what is lacking for the people who conceive naturally and not. So they keep doing their own work even without having the awareness that they have conceived. Okay, so that is it. Yeah. Any questions if you want to take, Anjali, I can.
Yes. So those who are asking about recording of the session, yes, recording of all the sessions will be provided to you with 1 year access to the recording. Plus, like we said, in the 21 days program, you will get weekly diet plans, a live WhatsApp group support with Dr. Rishi, and two bonus live sessions that we can call catch up call with Dr. Rishi, so that you can ask your query and discuss challenges with her. Can we do Zumba after ovulation? Pratiksha is asking.
Of course, yes. I have clients who are dancing, taking a professional dancers getting pregnant naturally through when you're dancing as well. But it depends upon the higher intensity. If you are actually suffering with some kind of fertility issues, knowingly known fertility issues, existing fertility issue, then taking Zumba is not going to help you. Maybe what you need is a moderate intensity practice. We will be discussing on what type of exercises and sequence you will be doing in the second session of the program as well. The first session is all about the foundation. The second session is all about the action plan. In the first session, you will be assessing all by yourself. What problem do I have? That is what the first session is all about. Second problem, you will get all the solutions. What I have to do from this point onwards to try to conceive naturally. That's all about in the second session. And the third session is all about the supportive approaches that you can do at home, like the castor oil packs and all that. How the naturopathic packs and therapies work. That is what is concluded in the like compiled in the third session. So all of the three sessions is given to you at a one day after day, like the continuous interval. That is to make sure you're not getting 1 week or 2 weeks time in between to program your next lifestyle activity. So we planned it that way that the sessions are happening in the first 3 days and the follow-up calls are happening at regular intervals. And the follow-up session will have slight inputs on what you have to do as well. I'll be also having a 15 minutes of session and I will be asking, the question and answer session will also be taken. And
Yeah.
the question and answer will be complete end to end. I will not be missing any questions over there. All right. Like now we might have some time constraints and all that, but yes, we can't have time constraints over the paid session. All right. Yeah.
Okay, so yes, last words from our side that if you have any kind of problem like PCOS, PCOD, irregular periods, thyroid issues, and for any issues like blockage in fallopian tube, endometriosis, delayed periods, body heat like endometrium lining issues, so you can surely join this
Presentation
program.
issues, if you have miscarried in the past, if you have already, some kind of endometrial problems like endometrial lining abnormality, estrogen dominance, hormonal imbalance, the clear-cut sign of deficiencies or some kind of autoimmune conditions, all of this, you just try joining this program. And from there, you can decide all by yourself. All right,
Yeah.
it will be like a very good beginning for the pregnancy journey.
Yes, and in 21 days, we are going to, provide you enough knowledge that how you have to start, and in 21 days, you will get it a complete idea that how you are going to proceed for the further months. So, yeah, Fatima, in 21 days, we are not going to say that you are going to get pregnant in 21 days, but yes, in 21 days, we
Yes,
are
yes.
going.
No, no, no. This is just see. I have my clients enroll for fertility programs for 3 to 5 months. It's just the beginning, the right beginning. You have to do before you try to conceive. Actually, when you're trying to conceive, this is the first step. The session might be the starting step for the conception journey. And from there, within 3 months, if you follow all the approaches said and done inside of the session, you might be given all the supportive documents. Diet charts will be provided, commitment sheets will be provided for you, and all the treatment approaches, what we are doing inside of the program, everything will be given to you. So that as a kind of a dictionary, you can take a reference and follow it from there. You will be like able to conceive within 3 to 5 months naturally if the condition suits. If you don't have other comorbidities, if you don't think you have other problems like unexplained infertility and all, it works amazingly better with the program. All right. Yeah.
So I hope we can end the session now. Thank you everyone for joining this session, giving your precious time, and thank you, Dr. Rishi, for guiding us on free. Thanks everyone.
Masterclass, thank you. I say it takes a lot of effort and time to prepare a session, and to put it forward to you. It takes almost an hour or so. It almost it takes a 4 hours of session to put forward to you as a free thing. If you can do that for free so much, think of the value we give the committed sessions with paid people. So it is definitely going to help you in the first place. I wish all of you, whether or not you're joining the program, an amazing pregnancy journey, and you will conceive naturally as well. Wishing you all the very best, taking you forward for the very special beginnings from now on.
Yeah. Thank you everyone. Thank you, Dr. Rishi.